When it comes to having regular access to healthcare providers, it's estimated 15% of Canadians do not have that. Here in some parts of Toronto, that figure rises. But some members of the LGBTQ2S plus community say finding a queer-safe space is getting harder.
We were just kind of abandoned, is really what it felt like, in the midst of a pandemic.
Joey Jamil is one of tens of thousands in Toronto today without a family doctor after his physician in the village left the practice, one he said offered great care, at the end of 2020 to go elsewhere. Unable to follow his doctor and with no option for a wait list available to him or his partner, Jamil has been on a months-long search to find a queer-friendly medical provider. As a member of Toronto's LGBTQ2S plus community, the void left behind is deeply personal.
My whole life, I found it really difficult to talk about my sexuality to my doctor. There was a barrier. I felt judged. Sometimes whenever I would try to talk about things, there were certain, I guess, nuances with the community that other doctors didn't fully appreciate.
Nuances such as being able to fully discuss sexual health and prevention medications, the dynamics of queer relationships, as well as people questioning their sexual orientation and identity. Desperate to find a new doctor, he says he sifted through valuable directories but found the task a bit overwhelming, so he turned to Instagram, posting a call out for leads.
More people were messaging me about not having a queer-friendly doctor or being able to, or having difficulty finding one than people were messaging me about actually having one. And so that's really what was upsetting to me.
Kinnan Ross McKinnon is an assistant professor at York University's School of Social Work and was part of a team that issued a paper looking at the healthcare sector as it relates to those who are transgender, finding dated approaches when it comes to offering critical supports.
2S LGBTQ communities are very diverse and, we're all differently situated.
He's calling for stronger healthcare initiatives to serve the LGBTQ2S plus community and universal access to drugs. McKinnon echoes Jamil's concerns about finding queer-friendly doctors and how they can play a pivotal role.
It means the world of difference because it means being understood and also receiving more competent and timely care.
Meanwhile, back downtown, Jamil has a simple plea.
The main message is reduce the barriers and get people access.
Now, for much more on this story, you can go to our website, citynews.ca. In Toronto for City News, I'm Nick Westoll.